It's been 2 years since the start of the COVID-19 pandemic, and the world has seen the emergence of several variants of concern. In 2020, we saw the emergence of Alpha, and this was later followed by the Beta and the Gamma variants. In July 2021, the Delta variant emerged as the predominant circulating variant in the United States and worldwide. My name is Raymond Razonable. I'm professor of medicine at the Mayo Clinic in Rochester, Minnesota. I'm going to give you the highlights of the study that we performed, effectiveness of monoclonal antibodies in preventing severe COVID-19 with the emergence of the Delta variant. That will be published in the February 2022 issue of the Mayo Clinic Proceedings. Anti-spike monoclonal antibodies such as bamlanivimab, etesevimab, casirivimab, imdevimab, and sotrovimab have proven highly effective in the treatment of high-risk patients with mild to moderate disease. Studies that were conducted by our group have demonstrated that during the alpha and the beta period, these antibodies prevented the progression of infection, preventing it from progressing to severe disease, and this has resulted in significant reductions in the rates of hospitalization, the rates of intensive care unit admission, as well as mortality. Studies have shown that Delta is more transmissible and may cause more severe disease when compared to its previous variants. To date, the Delta remains as the variant that's causing the current surge of infections in the US and worldwide. This rise of Delta begs the question, do anti-spike monoclonal antibodies remain efficacious for the treatment of high-risk patients? This is indeed what we studied. With the emergence of Delta, we compared the clinical outcomes of patients treated with monoclonal antibodies during the period that was dominated by the Alpha and the Beta variant, and compared this to a period that was dominated by Delta. We looked at the outcomes of over 5,300 individuals, and we observed that overall, the odds of severe infection were 3% of patients treated during the Alpha and Beta predominant era, and it was significantly higher at 4.9% during the Delta predominant period. The odds of having severe disease was higher in the Delta compared to the Alpha and Beta predominant period. So what does this mean? To us, this means that the higher odds of severe infection could be due to the fact that the Delta is really indeed more virulent compared to its predecessors, although the possibility of reduced efficacy among our anti-spike monoclonal antibodies cannot be excluded. In our experience, however, treatment with these monoclonal antibodies remains significantly better in preventing severe outcomes than having no treatment at all. We therefore encourage continued research to determine the most effective strategy in utilizing anti-spike monoclonal antibodies for the treatment of COVID-19, especially as more and more variants of concern are emerging. We invite you to read the details of this study that will be published in the February 2022 issue of the Mayo Clinic Proceedings. And thank you for listening.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.